questions are based on order entry and processing. Order entry and processing topics includes procedures to compound and non-sterile products, formulas, calculations on concentrations and dilutions, and also ratios and day supply calculations, and equipment supplies and devices that are used for medication administration, lot number, expiration dates, national drug code, NDC number, and procedures for identifying and returning dispensable. And all these topics include, there are 50 questions presented here in these mock exams. And all those questions are simulated to give you a good practice for real exam. So we're trying to have these similar to the actual exam questions. However, they're not necessarily exactly same questions you may get in the exam, but it can be inspired from these questions and prepared from those questions. I can confidently tell you that helps you to pass your exams. So let's start with this question number 1. Which of the following medication cannot be taken with glass of milk? A. Amoxicillin, B. Azithromycin, C. Metformin, D. Ciprofloxacin. I'll give you a few seconds pause so you can guess your answers and select your answer. Here the correct answer is ciprofloxacin. There are medications like fluoroquinolones, example ciprofloxacin, tetracyclines, and levothyroxines and bisphosphonates. These medications should not be taken with glass of milk because this can significantly reduce or decrease the absorption of these drugs. So for that reason, one should space or separate at least 2 to 4 hours taking milk with these medications such as ciprofloxacin. Next, a pharmacy technician is compounding an ointment that require mixing a solid ingredient into a base. What is the best technique to use? A. Trituration, B. Levigation, C. Emulsification, D. Filtration. The correct answer is levigation. Levigation is a process you reduce particle size of the solid first by powdering them in triturating method in the mortar and pestle, and those powder if you want to mix with the other ointment base, you have to make a paste of that one. To make those paste, you levigate them with the levigating agent to the powder. So commonly used levigating agents are mineral oil and glycerins. Next, how many tablets are dispensed to a prescription of prednisone 5 milligram tablets with the below directions? 3 tablet twice a day for 2 days, 3 tablet once a day, 2 tablet twice a day, and 1 tablet twice a day for 2 days, and 1 tablet once a day for 2 days. So answers here: A, 16 tablets, B, 32 tablets, C, 64 tablets, and D, 128 tablets. I know this question may take more than a minute, so I'll pause you for a few seconds, calculate this dose. So question is asking how many total tablets are dispensed for this prescription. Correct answer is 32 tablets. So if you look at this here, first 3 tablets twice a day, that means that total would be for 2 days 12 tablets. And then second 3 tablet once a day for 2 days, that would be equal to 6 tablet. And then 2 tablet twice a day for 2 days, that is equals to 8 tablets. And then 1 tablet twice a day, that's equals to 4 tablets. and one tablet once a day for 2 days, that would be equals to 2 tablets. So if you add all those together, the sum of this would be 32 tablets. Next, which of the following characteristic must be the same for two drugs to be considered therapeutically equivalent? A, they must have the same inactive ingredients. B, they must have the same active ingredient, same strength, same dosage form, and the same route of administration. Correct answer is they must have therapeutically equivalent, or also known as pharmaceutical equivalent. They must have the same active ingredient, means same chemical structure, everything exactly have to be the same. And they also have the same strength. If it is a 10 milligram, both of them have to be 10 milligram. Same dosage form, such as if it is an oral tablet, have to be oral tablet. Same route of administration. And they also have to be bioequivalent. And generally you find these bioequivalents of the drugs in reference called FDA's Orange Book. Next question is National Drug Code. What do the first four digits represents? A, package size. B, drug manufacturer. C, specific drug product. D, expiration date. Correct answer is the first four digits represents the drug manufacturer. Also can be referred as labeler. So here presented simplified version. The first four digits here are manufacturer, whereas middle four digits are specific drug, and last two digits are about package. So this manufacturer product is also known as labelers. Next, a prescription written for Synthroid, but the pharmacy dispenses levothyroxine. This is an example of A, generic substitution, B, drug compounding, C, therapeutic duplication, D, contraindication. Correct answer is generic substitution. Generic substitution is a dispensing of therapeutically equivalent generic drugs in place of brand name. Like here in this case, Synthroid is a brand name, whereas levothyroxine is a generic. So this kind of substitution is referred as generic substitution. Next, a pharmacy technician is restocking medication and notices that hydralazine and hydroxyzine and hydralazine both are stored closely together on the shelf. So what is the best action to take? A, move the bottles apart and use shelf labels to reduce the risk of LASA drug, which is a look-alike, sound-alike drug errors. Because when they have two drugs sound-alike name, such as hydroxyzine, hydralazine, there is a high chances they can have a LASA drug errors, means look-alike drug errors. So one action can be taken here, the best action. Think, it is a simple thought process you can use to think what is the best action can be done by pharmacy technician. The best action pharmacy technician can do here is do not keep them together, separate them, or keep them apart. That's the best action can be taken by pharmacy technician. Next, Dr. John Smith is a physician with DEA number AS1234563. And that what is S, the letter S indicates? The letter S indicates A, registration type like physician, B, first letter of the prescriber last name, C, first letter of the prescriber first name, and then DEA numbers with A as the first letter. Correct answer is first letter of prescriber last name is this referred as S. For example, in this case, prescriber name is John Smith. Smith is the last name, first letter is S. So therefore, this letter is the first letter of the last name of the prescriber. Whereas the first letter indicates type of registrant, such as physician will have A, other prescribers have different letters. And then the middle letters, like 6 digits, or unique identifier digits of a drug. And then last 3 digits number is called checksum digits. Next, if a drug manufacturer issues a recall for a medication due to contamination, how should affected products be identified? A. By looking at NDC number. B. Checking the lot number. C. Checking the drug expiration date. D. Reviewing the pharmacy purchase records. Correct answer is checking the lot number. So the lot number is used for tracking the drug's recalls. Because that lot number is a unique identifier assigned by manufacturer to specific batch of drug or product, and that is used for tracking recalls and quality control. Next, a medical indigent patient does not A. Have enough money to live on, B. Have enough money for medical care, C. Have a health insurance policy, have income for travel. Correct answer is a medical indigent patient does not have enough money for medical care. Next, which of the following is true regarding the administration of ophthalmic drops? A. Patient should tilt their head forward and pull down the lower eyelid and still drop into the conjunctival sac. B. Should lie down for at least 30 minutes. C. Should tilt head in the back and pull down the lower eyelid and still drop into conjunctival sac. So therefore the correct answer is C. For ophthalmic drop, patients should tilt their head back and pull down the lower eyelid and then instill drops into this pouch or and conjunctival sac, that is after pulling. Next, what type of needle is required for withdrawing medication from an ampoule? A. Standard hypodermic needle. B. Filter needle. C. Insulin needle. D. Lower lock needle. To draw the drugs from ampoules, you should use filter needles because there can be a small glass pieces can possible from ampoule. So that's the reason why you need to use filter needle when you use ampoules. Next, a patient is prescribed a 5 ml of dose of oral liquid for 3-year-old child. Which of the following device would be the most accurate for measurement? A. Household teaspoon. B. Dosing cup. C. Oral syringe. D. Plastic glass. The correct answer is oral syringe. What is the purpose of an enteral feeding tube? To administer medication directly into the veins. B. Deliver nutrients medication directly into the gastrointestinal tract. That's the correct statement. To deliver nutrients medication directly into the gastrointestinal tract for those who cannot take nutrients directly from their by orally. So therefore, those who are unable to eat orally, for them, these enteral feeding tubes are used for administering nutrients into their gastrointestinal tract. Next, which of the following is true about use of nasal spray for drug administration? A. They are primarily used for antibiotics. That's not correct. They deliver medication directly into the nostril and absorbed through nasal mucosa. That's the correct answer. So this is sprayed in the nose. That is known as nasal spray. Next, what is the purpose of ampoule in drug administration? Ampoule is a multi-dose ampoule used for storing insulin. No, it is sealed glass container that holds a single dose of medication. That's the correct statement. Ampoules carry the single dose of medications, and generally those are sterile preparations. Next, which of the following is a key advantage of using pre-filled syringes? A. Reduce medication waste, dosing errors. They are always reusable. C. They eliminate need for refrigeration. D. They can be used for any liquid medication. The best response of using pre-filled syringes are the reduced medication waste and dosing errors. Next, a prescription requires 500 ml of IV fluid to be administered over 4 hours. How many ml per hour should be infused? That's a straight question. So basically, this is asking about how many ml per hour should be infused. When you have a volume is given and then for time is given. So the correct answer comes to be 125 ml per hour. The standard formula for this is flow rate equals volume over time. So here volume is 500 mils and time is 4 hours. So that's a straight question that gives you total 125 mils per hour. That's your answer. Next, a patient with diabetes needs to inject insulin daily. What type of needle gauge is most commonly used for insulin administration? Gauge is a unit for measuring needle diameter. So here for insulin, 29 gauge is commonly used. So higher the gauge, smaller the diameter. Next, a pharmacist needs to dilute 1 gram of medication to make concentration of 250 milligrams per 5 ml. What will be the final volume of the solution? A. 10 mils, B 15, C 20 mils, and D 40 mils. The correct answer is 40 mils. So it's quite a straightforward question. They're asking you're diluting 1 gram, that leading to 250 milligram per 5 mils. That means 250 milligram has 5 mils. So 1 gram means it is a 1000 milligram. So 1000 milligram will be how many mils? So the best way to do is cross multiplication. For cross multiplication, point the arrow to the x. So if you point this arrow and then you get x mils equals 1000 milligram times 5 mils divided by 250. So it gives you 20 mils. That's your correct answer. Next question. What size of bottle for eye drops is needed for prescription GTTS 2 OU QID for 7 days? A. 6 mils, B. 10 mils, C. 15 mils, D. 20 mils. Correct answer is 6 mils. Let's do how did we get that one. Total quantity is GTTS means drops. 2 drops OU for both eye. So total 4 drops for 4 times a day, QID, and for 7 days. Total 112 drops. So standard is 1 mil has 20 drops. So now 112 drops divided by 20 drops, which is 1 mil. So that gives you 5.6 mils. So if you round that number, it comes to be 6 mils. Next, how many grams of hydrocortisone powder is required to prepare 2 ounces of 2.5% hydrocortisone ointment? A. 12.5 grams, B 2 grams, C 1.5, and D 1 gram. So I'll pause here for a second. Please calculate and find your answer. Correct answer is C 1.5. Here, quite a straightforward. 1 ounce is equals to 30 grams. So 2 ounces is 60 grams. So 25 grams have 100 grams, means 2.5%. 2.5% means 2.5 grams in 100. So for x grams is how many? So you do the cross multiplication by pointing arrows to the x, and then you get x grams equals 1.5 grams. Therefore, your correct answer is 1.5 grams. Next, a physician orders 150 milligram of drug that is available as 50 milligram per 2 mils. How many mils should be administered? So it is A 2 mils, B 4 mils, C 6, and then D 8 milliliters. Correct answer is 6 mils. How did we get that? Straight question. 50 milligram contain in 2 mils. So for 150, how many mils? So do this, point the arrow to x and then cross multiply. If you do that, you get 6 milliliters. Next, a child weighing 44 pounds, prescribed medication 5 milligram per kg. How many milligrams should child receive per dose? So first calculate this into the kilograms. That can be done by dividing 2.2. So that gives you kilograms. So here answer is 220. Let's see how did we get this 220 answer. So 44 pound gives you 22 kgs, and 20 kgs times 5 milligram per kg. The correct answer is 220 milligram. Next, a prescription calls for 2 ounces of cough syrup. How many mils should be dispensed? A 30 mils, B 45, C 60, D 90. The correct answer is 1 ounce equals 30 mils. So 2 ounces will be 60 mils. Next, a patient IV infusion is running at 30 drops per minute with a drop factor 15 drops per mil. How many mils per hour each patient is receiving? Calculated is I will pause and find check out your answers. Correct answer is 120 mils per hour. So here this is the standard formula to calculate drip rate and volume time drip rate factor by minute. However, we are calculating here how many mils, that means volume. So if you modify that formula, rearrange the formula, so then can be calculated mils per hour, that is 30 drops that convert into hour, and then this is the drop factor. So it gives you 120 milliliters per hour. Next, a medication label reads 5 mils every 4 to 6 hours PRN. What is the maximum number of doses patient can take in 24 hours? A 2 dosages, B 4, C 6, and D 8 dosages. Correct answer is 6 dosages, because when you have a every 4 to 6 means you take 4, means more frequency. So if you take that, that means it is a every 4 hours will have 24, that means 6 doses maximum. Next, a physician write for clonazepam 0.5 milligram, take 2 tablet TID with dispense quantity 180. What is the day supply? A 15 days, B 30 days, C 45 days, D 60 days. The correct answer is 30 days. So day supply is should be calculated total tablets divided by 1 day tablet. So in 1 day patient takes 6 tablets. So therefore 180 divided by 6 gives you 30 days. Next, what is the direction for the using C code 4GTTS PO oral every 12 hours as directed? So in the correct answer is give 4 drops orally every 12 hours as directed. Because here there is a GTTS for drops and then PO for by mouth, and every 12 hours is Q12H. UD means as directed. Next, a patient has insulin prescription that state inject 10 units SC subcutaneous every morning and 20 units subcutaneous every evening. The pharmacy dispense a 10 mils of vial of insulin. What is the day supply? A. 10 days, B. 20 days, C. 25 days, D. 30 days. The correct answer is total daily units are 30 units per day. And then you have a vials containing 100 units per mil means for 10 mil that would be 1000 units. So again, day supply calculation, you should total units divide by daily 1 day unit. So if you do that, 33 units. So round the numbers to 30 days. Next, a patient is prescribed oxycodone 5 milligram tablet with instruction to take 2 tablets every 6 hours as needed for pain. The doctor prescribes 7 days supply. How many tablets should be dispensed? A. 14, 28 tablets, C. 42, D. 56. Here the question is asking 2 tablets every 6 hours. That means um, every 6 hours means 4 times a day and 2 tablets. So in a 24 hours, that would be equals to 8 tablets. So there are 7 days, that is 7 into 8, 56 tablets. Next, a prescription is written as albuterol 90 microgram inhaler. Inhale 2 puffs every 4 to 6 hours as needed. Dispense 1 inhaler containing 200 actuations. What is the maximum days supply if patient uses 4 hours, every 4 hours? So that means patient is using every 6 times a day. So if you calculate how much you get, A, 10 days, B, 15, C, 25 days, D, 50 days. So these 200 doses can be used for 25 days. So per day, patient take 12 puffs, and 200 divided by 12, that gives you 25 days. Next, which of the following preparation may contain sugar? A. Tincture, B. Solutions, C. Spirit, D. Syrup. The correct answer is syrup. Syrup is basically mixture of sugar and water is what's sugar, syrup. A patient required 2.5% of lidocaine solution. Pharmacy has 5% lidocaine. How much of 5% needed to prepare 100 milliliters of 2.5%? A. 25 mils, B. 50 mils, C. 75 mils, D. 100 mils. Correct answer is 50 mils. So this can be done by dilution formula, which is C1V1 equals C2V2. So if you plug in these numbers, this is the 2.5%, and now here you have to use 5%. So 5% is obviously it is a C1. But question is asking how much of 5% is needed. That is a question V1. So you have C2 2.5%, that is C2, and then you have 2.5% means 2.5 grams in 100, that is a V2. So 100 mils. So if you do that, if you divide them, you get 50 mils of 5%. So you're required to take 50 mils of 5% to prepare this 2.5% of lidocaine. Next, which of the following requires refrigeration? A. Latanoprost, brand is Xalaton, omeprazole, warfarin, apixaban. The correct answer is latanoprost. Eye drops have to be refrigerated in the pharmacy. Next, a pharmacy technician noticed patient received the wrong strength of the prescribed medication. What should technician do first? Call the patient to tell them to keep the medication, notify the pharmacist immediately, return the medication to shelf and replace it with the other correct strength, ignore the issue, continue working. Notify the pharmacist immediately. This may require pharmacist intervention, so therefore pharmacy technician should report to pharmacist. Next, a pharmacy technician is compounding 100 ml of suspension. What type of equipment is most appropriate for measuring suspension of this volume? A. Beaker, B. Graduated cylinder, C. Pipette, D. Mortar and pestle. Correct answer is graduated cylinders are used for measuring almost 100 ml of suspension volume. Next, a pharmacist asks a technician to remove all short-dated medication from inventory. What does that short-dated means? A. Medication that were recently ordered. B. Medication that will expire soon, like within 3 to 6 months. C. Medication that were dispensed in error. D. Medication that have a short half-life. The correct answer is medication that will expire soon, within 3 to 6 months. And those short-dated medications should be monitored. That means should be frequently checked to prevent dispensing errors of expired medication. Next, a patient is ordered to receive 1 liter of normal saline over 8 hours. Calculate the flow rate. 50 mils per hour, B 100 mils per hour, C 125, D 150. Correct answer is 125. So this is a straight formula. Volume, flow rate is equals volume of IV time to infuse. So here volume is 1 liter and then divided by 8 hours. That gives you 125 milliliters per hour. Next, a pharmacy technician receives a prescription for warfarin 10 milligram by mouth daily. The patient profile shows they usually take warfarin 1 milligram daily. What do you do in this case? A. Fill the prescription as written. B. Adjust the dose to 1 milligram, fill the prescription. Alert the pharmacist to verify abnormal dose. Or D. Ignore the discrepancy, process the prescription. Correct answer is C. Alert the pharmacist because there is a tenfold increase in warfarin dose, which is rarely that happens. So therefore, that requires pharmacist intervention. Next, a physician prescribes amoxicillin 400 milligram per 5 ml suspension with instruction to take 10 mils, 10 milliliter BID for 10 days. How many mils should be dispensed? A. 100 mils, B. 150 mils, C. 200 mils, and D. 250 mils. The correct answer is C. 200 mils. Here BID twice daily, that means 10 mils twice daily with 20 mils per day. So it is for 10 days. So that gives you 200 mils total. Next, which of the following is considered the least sedating second generation antihistamine? A. Diphenhydramine, B. Cetirizine, C. Loratadine, D. Hydroxyzine. Correct answer is loratadine, claritine. That is one of the least sedative antihistamine in second generation antihistamines. Next, a patient using anticoagulant therapy to treat venous thromboembolism Which of the following anticoagulant drug therapies require monitoring called blood work of international normalized ratio? A. Enoxaparin, B. Rivaroxaban, C. Dabigatran, D. Warfarin. Correct answer is warfarin. For warfarin, INR is used for monitoring their blood work. Next, a patient requests to refill their blood pressure medication 15 days early because they are going on vacation. What should this technician do? A. Refuse the request for early refill. B. Inform the pharmacist about patient request for early refill. Dispense only partial supply. Ignore the request and proceed with refill. Correct answer is B. Inform the pharmacist about patient request for early refill. Pharmacists can do those 15 days before early refill that can be covered by most insurances. Next, which medication require handling precaution a technician should handle with gloves? A. Insulin, B. Warfarin, C. Methotrexate, D. Lisinopril. Correct answer is methotrexate. Methotrexate is a chemotherapeutic drug. Hazardous drugs require to handle by wearing the gloves. Next, which of the following medication dosage form require caution to contain alcohol, especially in children and pregnant women and elderly? A. Suspension, B. Elixir, C. Emulsion, D. Ointment. The correct answer is elixirs. Elixirs are containing hydroalcoholic base, both water and alcohol. It is between 3 to 25%. So therefore, this medication require precaution in small children, pregnant women, and elderly. Next, what size of syringe should be used to measure 7.5 mils accurately? A. 10 mils, B. 15 mils, C. 20 mils, D. 25 mils. The correct answer is 10 mils. The syringe size should closely match the volume being measured. 10 mil syringe is the most appropriate choice for 7.5. Means the next biggest size you should select. So here these are the standard size of the syringes for use for various uh, administrations of the drugs. Like 1 mil syringes are generally used for insulins, vaccine, allergy testing. Those are the smallest one. Whereas 3 mils for IM injections, 5 mils also can be used for intramuscular, 10 mils are used for IV, and then larger one for tube feeding, and also 60 mils that's a G tube feeding. Those are the for specific use of high volume syringes. Next, before compounding a non-sterile medication, what is the minimum amount of time pharmacy technicians should wash their hands? A. 5 seconds, B. 10 seconds, C. 20 seconds, D. 60 seconds. The correct answer is 20 seconds. CDC recommend washing hands for at least 20 seconds with soap and water before handling the medication. Next, what antibiotic drugs, unopened medications are stored in fridge? A. Dulaglutide, B. Liraglutide, C. Semaglutide, and D. All of the above. All of the above are correct answer. All those as GLP-1 analogs such as dulaglutide, liraglutide, they're required to be stored in the fridge in the pharmacy. Next, which of the following administration means to dissolve in the cheek? A. Sublingual, B. Transdermal, C. Oral, D. Buccal. The correct answer is buccal. Buccal administration refers to placing medication between the cheeks and gum where it dissolves and absorbs directly into the bloodstream through the mucous membrane. All right, so with this drugs, these are the questions, 50 questions that are most likely tested. So continue, subscribe, and give a big thumbs up for Pharmacy Prep channel. Thank you. See you again.